Guys hear me okay? Give me a thumbs up. Yeah, it sounds like you guys can hear me. I'm going to be interacting with you guys. So if you want to drop, I think, let's see, you may not have the chat live. I couldn't figure out how to do that earlier, guys. So that's may not why you're not answering me here. So remember, if you guys have questions, save it till the end because I will get to those at the very end. I have a few slides to present to you guys because this is going to go out. It is a recording to you guys later, so you always have to have it to reference back. And I want the slides to be part of it too, so you guys have actual science and stats to look at a few things too of why I'm um, telling you guys about this because it's a big problem, right? So if you're here and you're live, thanks for coming. This is something that you guys, if you follow me online, you've seen me talk about this a lot about how long COVID has been such a big part of most of my patients' lives, especially when they come to me as mystery people and doctors haven't been able to figure them out. There's always some component of histamine, there's always some component of mast cell. There's always some hidden frenemies in the toxin bucket. And so until we can kind of tease all that out, people actually suffer. I'm sure if you guys could raise your hand right now, most of you would raise your hand and say you resonate with that. Because if you're here, it's probably because you haven't felt your best or someone you love hasn't felt their best for maybe years. I know a lot of people that I see, they see sometimes upwards of 20 doctors. They get lots of regular labs and then move into the functional world, get functional labs, and still this is often missed. And so I want to provide you guys with enough knowledge and information in this webinar so you can take it back to your doctors and ask for the right test and really ask the right questions. And if you can't get what you need from your practitioner, then it might be time to find a new one. And so that's, I'm here to help you guys with that too. So save your questions till the end, because we are going to go over that at the very end as well. So, okay, I'm going to start going over my PowerPoint with you guys really quickly, okay? And so I'm going to share my screen. You guys are going to get a lot of different information about just what we're going to cover, and I'm going to give you guys practical solutions at the end. I'm going to teach you about how to read a proper Epstein-Barr panel as well. And, there's going to be very problem-specific solutions at the end for you guys to cover some of this stuff. And I try to make it very simple and pretty affordable for most people too, because it's not easy out there right now. Okay. All right, guys, let me pull this up for you guys here. Okay, perfect. Hopefully everyone can see my screen. All right. So if you guys are here, we're covering mostly Epstein-Barr, but other herpes viruses as well, how they affect long COVID, and how histamine actually plays into all of that, because actually they're kind of connected, directly connected is what you'll see. So if you're someone who has had cold sores or shingles or you know, Epstein-Barr or mono in your life, you may not know, or you may know that these things can reactivate under certain conditions. And so in the last 5, 6 years, if you notice that people have been suffering more with these herpes viruses or histamine problems, you are not wrong. Okay. All right, guys. So first and foremost, the herpes family here. The most popular one that most people are suffering from is mono, and that's herpes type 4. Cold sores and the STD are considered herpes simplex virus, type 1 and type 2. Varicella zoster is type 3, that's chickenpox. And then later, as you get older, they say our immune system wanes, and that's why it reactivates. There's other reasons too that we're going to talk about as well. Herpes type 5 is cytomegalovirus or CMV. That one often flies under the radar, but in the functional world, you can get specialized testing for that. And finally, HHV6, which is roseola in children. And as you get older, this can reactivate and cause a lot of chronic fatigue syndrome, chronic fatigue conditions. Okay, guys, so what are we going to cover today? The herpes virus family and EBV, there's 9 of them, but we're going to talk about the most popular ones that are reactivating during the COVID years. Some of these are shingles, right, and herpes simplex. Some of this is going to be related to long COVID and how that persists. And even if you didn't have a horrible COVID case, but you got COVID multiple times, that can also be a red flag. And then testing, targeted support, and options for you guys and your family, and stuff that's even safe enough for children. Okay. All right, guys. So first and foremost, herpes type 4, which is Epstein-Barr virus. So if you had mononucleosis, or you've tested positive for it in your life, which 90% of people are seropositive for having a past infection with Epstein-Barr virus, even if they don't remember having mono. So it's really, really, really common, as you can see. So if you are someone who had your tonsils taken out, you were told you had strep all the time, I can almost promise you that there was a component of Epstein-Barr piggybacking at one of those times because they don't always do a monospot. They always do a rapid strep, and many of these things come together in clusters. So again, this one is herpes type 4. It does infect B lymphocytes. It's a type of white blood cell, like a soldier cell that fights viruses and cancer. So it's really important that we keep these B lymphocytes safe, right? They really target your immune system. And Epstein-Barr often colonizes here in the tonsils. And like all herpes viruses, it goes into remission. It doesn't really fully leave. Our body has to stay resilient and balanced, and that's actually how we keep the virus at bay. It's due to our terrain, actually, of our body. So most carriers, as you can see there, stay well. They don't have ongoing problems, but that's not the case since COVID. It's really been something has changed within the population. Okay, so we talked about this a little bit, how it hides in the white blood cells or specific immune cells called lymphocytes, B lymphocytes to be specific. And these are the type of lymphocytes that make antibodies that fight all kinds of different infections within the body. So this virus will drive into the B lymphocytes and start to replicate or proliferate. And then it travels to the lymph nodes. And you think about your tonsils, your spleen, you have a lot of lymph nodes in your microbiome, places like that, right? And these cells then settle into the memory beta B cells or B lymphocytes. And that's Epstein-Barr's lifelong hiding place where it can reactivate from if it gets the chance later on. It's very opportunistic. So as you can see there, what reactivation occurs as a memory B lymphocyte matures into something called a plasma cell. Then the dormant virus can switch back on, as well as when we're down and out, we're stressed out, we're sleepless, all those different things. I'm sure many of you guys have experienced that. So you might be asking what wakes the dormant virus up here. And if you've lived life, you've probably experienced some of these at some point in time. I know I have personally, and I'll tell you guys a little story when I'm done here in a minute. So stress in general is the biggest one. If you're in flight, fight, or freeze, or the wrong type of vagal tone, because the vagus nerve controls part of our autonomic nervous system called the parasympathetic nervous system. So if you're constantly stressed out, and this can be so subtle because it can happen insidiously to all of us over time. And then before you know it, you're so stressed out you don't even recognize yourself, but it's such a slow roll and progress that many of us don't pick up on it in our own selves. And this is the biggest one that I want to stress. Even if you join my clinic or Wellness Plus or my protocols, I always have a nervous system regulation first month with everyone because that's actually what makes the protocol stick. So you can see cortisol and adrenaline, part of the autonomic nervous system, right? These are stress hormones that definitely let these pesky herpes viruses reactivate. And then also any sort of illness. So we're going to talk about COVID. We're going to talk about long COVID and how that can strain the immune system. It's kind of like in a hypervigilant state where it's turned on, right? And then finally, if you're not sleeping, this is a huge one. Our body heals and rest and digest. So if you're not sleeping and you can't get into a deep restorative rest and digest or sleep, the body never fully can heal. This is actually the best doctor there is, sleep. So if you can't sleep, we need to get that fixed for you immediately. And sometimes that's because you're full of pathogens, right? So we know the reactivation symptom pattern here. There's something you guys want to look for with Epstein-Barr, especially if it's started to ramp up since the COVID years. There's a reason for that. And we're going to talk about that. But the symptoms of waxing and waning Epstein-Barr virus or waxing and waning sore throat. Kind of feel like you're coming down with something. It's maybe scratchy. And you may even lose your voice. There's tender, swollen lymph nodes, either in the groin or the neck. And then there's persistent, sometimes unbearable fatigue, brain fog, generalized body aches that may come and go, and really low motivation. And you may not want to get up off the couch or out of your bed. And it really comes and goes with stress or the perception of stress, insomnia, or something like COVID, right? So if you catch COVID or upper respiratory illness, this thing can often rear its ugly head on top of that and make you feel even worse. So shingles here. I know there were a few of you guys online that really couldn't wait for me to talk about shingles. So you guys, shingles is really misunderstood. People are like, oh, it's not that painful. It's actually very, very, very painful. And patients are underestimated and often dismissed when they sometimes need narcotics for pain because it's so bad. And this is 1 in 3 US adults are going to get this if you ever had chickenpox, which is the virus can reactivate later in life under stressful situations. Again, it goes back to the terrain of the body. But this one in particular, shingles is sort of similar to herpes simplex virus. It hides in dormant, goes dormant in nerve roots. And it actually comes out in the same pattern on one side of the body when the terrain is not at peak performance or you're kind of down and out. So you'll see the rash start to appear eventually in that same pattern. But before that, there's a prodrome, which means sometimes you'll feel like a tingling or just an awareness around that area that something's coming, that there's a little bit of inflammation in that area. So they like to blame age, but it's much more than that. It's more like age on top of stress, on top of recurrent illnesses. Maybe you have antibiotics that wiped out the microbiome or steroids that lowered the immune system, and general immune suppression, right? That can be for a lot of different reasons for people. This lowers the T lymphocytes that really go after something like a herpes virus like varicella zoster or shingles. And even after you get over the initial rash and that's gone away from the body, people can have something called post-herpetic neuralgia. It can affect, 10 to 18% is quite a bit of people when 1 in 3 are supposed to get shingles in their lifetime. So, and that pain really feels like this sharp shooting electrical nerve pain that can persist long after the rash is gone. So that's no fun, right? So, shingles episodes here, like I said, the 1 to 5 days is about the typical time people will feel a certain type of prodrome, which is the burning, the tingling, the numbness, maybe itching even, that can come right before the actual outbreak of the rash. Sometimes people even have systemic symptoms. Sometimes they'll have a little bit of a fever or fatigue as well. Eventually, red patches appear that are pretty vesicular. They look like blisters on the body. And that's usually on one side of the body or the face, like I said before. And then about a week to 10 days after the initial outbreak, there's a crusting over of that rash. You can still shed the virus and be contagious actually to people who are susceptible. Maybe someone else who's stressed out or not sleeping, right? And most people do recover, but like I said, there is the chance of post-herpetic neuralgia, which is really painful for a lot of people. Conventional medicine will give you guys antivirals, right? If you have a cold sore, if you have shingles, if you have even Epstein-Barr, you may have been prescribed something like acyclovir or valacyclovir. And not to say that it work, they work great. They really take the rash or the pain away from most people. However, how that works is by suppression of the rash, kind of pushing it back into the body. Whenever you're able to harmonize the body with something like homeopathics, which I've really been impressed with as I've gone on in my career. You're able to pull it out of the body, and the body's immune system is actually what's fixing the problem. It's not just suppressing viral shedding, which is a lot of what these antivirals do. They stop the virus from replicating, but they don't prop up your immune system to prevent future outbreaks. Does that make sense? It's just stopping, like a band-aid, stopping the viral replication. However, homeopathics and herbs work in a different way where they're propping up the immunity. They're letting the body see the problem itself. And when the body sees the problem, it harmonizes it. It's like moving roadblocks out so your own immune system has it, which is what we want to actually fully heal the problem, right? So let's get into COVID-19. Regardless of whether we think this is an actual virus or a bioweapon, like many of us, I think, do, it's still a problem. People are still suffering from this. And there's a sensitive genotype or person that really suffers from long COVID years and years after the virus. I mean, if you guys go on Facebook groups, there are forums in there where people are bedbound. They are having panic attacks every day. They can't eat food anymore because they're having reactions to everything they put in their mouth. They're not sleeping at night because the histamine issues keep them up all night long. Or in their gut, they can't eat anything. It's really changed the trajectory of their health and their life. And the regular doctors are not so keen on understanding long COVID or reactivation of said herpes viruses that come with that. So as you can see, 27.1% of COVID patients test showed positive reactivation of Epstein-Barr virus by polymerase chain reaction or PCR versus 12.5% of COVID negative patients in the same study. So as you can see, Epstein-Barr is still a real problem for the general population, but in the COVID people, it's even a worse problem, right? I don't want you to think this is every single COVID patient has a herpes virus reactivated. That's not what happens, but it is a big portion of the population, especially if people have never recovered since 2020. It's a very strong case for this. And herpes simplex virus is really linked to things like steroid treatment, mechanical ventilation. It's a treatment illness type effect, not COVID alone. But let me see, this is what the studies show, guys. I'm quoting what the studies say. I have a very personal experience with this. In fact, during the COVID years, I was traveling a lot for speaking gigs. And I would get on a plane and get like a little, like not even anything to be sick about. It was like a more annoying than anything, maybe like the sniffles or an upper respiratory infection. And then I would try and get a cold sore. And I would be like, wow, that was COVID. Oh, that was COVID again. Because before COVID, I didn't do that. So there's something that changed within those years for me. And it was either the radiation, the 5G towers alongside of COVID, which kicks up histamine and allows something like a cold sore to reactivate. So this is what the science says, but that's my anecdotal evidence for myself. So like I said, we need more studies. Okay, so Epstein-Barr reactivation does show up more in long COVID patients. And if you have the genotype HLA-DR, you are more set up for Lyme and mold and breast implant illness and long COVID. So 66.7% of long COVID patients showed Epstein-Barr reactivation numbers. That's a lot. And then that's 10% of matched controls showed the same markers. So this is again a correlation to observational studies. So it's not proof that Epstein-Barr alone causes long COVID. So there is a correlation here, guys. And as you can see, especially fatigue and neurocognitive dysfunction. So you may be living this life right now, and I don't need a study to prove it to you, but which symptoms long COVID tracks with Epstein-Barr virus? So of course, fatigue, of course, brain fog, cognitive issues, word finding difficulties. There's other long COVID symptoms like palpitations or acid reflux, loose stools, hives, eczema, different types of rashes, itchy skin. Definitely a lot of acid reflux and bloating for people, brain fog, cognitive issues, panic, anxiety, ruminating thoughts, all of that stuff. So you can see here what happens with a lot of these latent Epstein-Barr reactivations, even herpes simplex or shingles. There's chronic stress ongoing because life is lifing, right? That spikes our cortisol chronically, so we're in a hypervigilant state where our body constantly thinks we're running from a bear. Our immunity then drops. When they say T cell surveillance drops, our T cells are the ones that are out scouting around looking for problems. When their surveillance activity drops, that's when the viruses are opportunistic. It's their 15 minutes of fame. So as you can see here, there's actual things that show that this is real life here as well. Stress hormones directly reactivate Epstein-Barr in studies. You can see very much related to psychological stress. I also just would be remiss if I didn't bring up the autoimmune connectivity with Epstein-Barr virus. We already know that 90 to 95% of people have had a past infection. We don't really know how many people are currently suffering from reactivation of Epstein-Barr. And we should know this number because there is 7 to 8 different autoimmune conditions that we know of that are linked to Epstein-Barr virus that has not gone dormant completely. And the most highly correlated is multiple sclerosis. Um, so, zero multiple sclerosis cases in the Epstein-Barr seronegative group of a large military cohort study. And lots of them had it. So, there is a correlation here. Epstein-Barr proteins like Epstein-Barr nuclear antigen 1 closely resemble certain proteins made by our own cells. And so, our immune system will try to fight those Epstein-Barr infections that it sees, but some of those antibodies look like our own body. And so it's actually kind of a case of mistaken identity as the body's trying to always protect us. But when these viruses are pretty sneaky and they look like us, our body gets confused. And over multiple reactivations, this can tip a genetically susceptible person towards autoimmune disease. The other things that are correlated are things like lupus, Hashimoto's, Sjogren's as well. So this is the third piece of the puzzle, you guys. So you may be thinking just because someone gets COVID, if you guys may have heard, I had COVID on my birthday a couple weeks ago, and I broke out in a histamine rash. I had eczema that broke out, and then I got sick with COVID. And so COVID directly reactivated histamine and mast cells in my body. And I'm telling you that the practical solutions I'm about to give are the only reason I didn't try and get a cold sore. So there are ways to prevent this from happening, but really mast cells go crazy with long COVID or COVID in general. That's because the spike protein is something novel, whether made in a lab or not. It's something our body has never seen before. So our bodies are always smart. They're always trying to protect us. It's society that's toxic. With that being said, the spike protein, they're like, what are you doing here? You're not supposed to be here. We're going to kill you. Inflammation, histamine. So histamine is your first line of defense in killing foreign intruders. So of course your body's releasing that. Of course it is if it sees the spike protein. The problem with that is if you have dormant viruses or past exposures, specifically the herpes virus, then this can reactivate, especially when histamine's kicked up. Your body's off kilter. It's out of homeostasis, and these viruses take advantage when you're hospitable. So this is the third piece of the puzzle is the histamine. Mast cells on alert, histamine builds up, symptoms overlap with Epstein-Barr and reactivate. And then sometimes this is why antihistamines, whether they be herbs or a DAO enzyme or actually something like Claritin or Zyrtec, can often be very helpful for people with long COVID, long haulers, and the Epstein-Barr fatigue that's real too. So I did want to go over with you guys, as promised, how Epstein-Barr testing works because I can almost promise you that if you've had a panel, your doctors did it wrong. I can almost promise you. And that's because they leave out the one important marker that lets me know whether a past infection is currently reactivating in a problem. It's like catching a kid red-handed in the cookie jar. So if they don't get this marker, you can have these off the chart numbers for past infection, and no one knows whether it's a current problem. So let's see here. The viral capsid antigen, VCA IgM. IgM is a antibody you make when it's a new infection. It doesn't always have to be new. I have seen IgM reactivate in really chronically immunosuppressed people where their immune system's just really confused. But in general, you make this one when it's a new or acute infection, right? It usually fades within weeks or months. These things do stick around for a while. The viral capsid antigen IgG means you've had a past infection. Your body made antibodies to recognize it again if it happens, like because you might get it again. You now have antibodies for past infection. These are here for life. Although if they're really, really high or out of control, it does signal there is some immune surveillance problems and the body is struggling with immunity with a virus. Here's the one most of the doctors miss is the early antigen. It's very astute and well-versed doctor if they're ordering this on your Epstein-Barr panel because this has to be ordered separately. So this is really associated with the active viral replication or reactivation, if you will. And it, like I said, if you're feeling like you've got scratchy sore throat, you're coming down with something, swollen lymph nodes, maybe a little body aches, fatigue, this is when to check this panel because you can catch that early antigen reactivated, and then you know what the root cause of your problem is. Finally, there's the Epstein-Barr nuclear antigen IgG. This again signals a long past infection marker. So it doesn't appear immediately. It takes sometimes months to appear, and then it lasts a lifetime, just like the viral capsid antigen IgG. Okay, so they have different time to appear within the blood work, but they both last a lifetime and show a past infection. So remember, early antigen IgG is key to know if Epstein-Barr is currently a problem for you. Okay, so this is just kind of a little cheat sheet. You guys can take a picture. You can send it to your docs. You're going to get this recording later, so don't worry. But as you can see there, depending on whether things are positive or negative, show how, if you have a current infection, a past infection, possible reactivation. And then maybe you already have something that's cross-reactive or developing on its own. As you can see, it's not a fresh infection on the last one. So it's kind of a little cheat sheet to see how you guys can read each marker and become your own best doctor here. So sometimes there are some nuances to all labs, right? Even functional labs, no matter how good, they can't be perfect, right? You have to know the good, the bad, the ugly about all the tests. So as you can see here, read that in the red, only about 3% of blood samples with elevated early antigen markers show detectable Epstein-Barr DNA by PCR. Now, PCR, we've seen how faulty it can be as during the COVID years. If you guys kept up with COVID, you know PCRs are not the greatest test all the time. So just because we catch an early antigen positive doesn't mean that we always check the DNA or always see the DNA of Epstein-Barr within the blood, is what this is saying. So it doesn't always mean it's a clinically distinct acute event. It can mean that your immune system is reactivated again, which anytime your immune system is reactivated or hypervigilant, you're going to feel rotten. It's actually your immune system, not the pathogen, that makes you feel terrible. It's your immune system that gives you a fever to kill something. It's your immune system that causes swelling and histamine when it sees something that's foreign to it. So just because the virus isn't really replicating doesn't mean that your immune system isn't still seeing it as a problem, is what this means. I'm not going to read all these studies to you guys, but you can see symptom severity doesn't cleanly track with high titer either. So titers aren't the best thing to check either, in my opinion. Okay, so what do we do about Epstein-Barr or shingles or herpes simplex virus? These all goes for all the different herpes viruses here. So first and foremost, we have to address the terrain of the body, right? We have to have your vessel as clean as possible, and you as stress-free as life will let you be. So that way your body is the best self-assurance against viruses or any other type of pathogen. So sleep is first and foremost the most important thing. If you're sleeping 4 to 5 hours a night chronically, that's a problem. And long COVID will do that to you with histamine release in the brain. It will cause insomnia. It will cause you to wake up multiple times having to pee at night. So we have to get on top of the histamine sometimes with a Band-Aid before we can get to the root cause. Stress regulation, we've talked about that again. Nervous system dysregulation, really, really hard thing to treat. And sometimes takes me a month or two, depending on the person. Sometimes we're treating it the entire time because their body feels so unsafe. And many of you guys will feel safe here in the mind, but your body tells a different story. If you'd ask your body if it feels safe, most of the time your guys would say no. And that's where the mind-body disconnection comes in, and illness can creep in after that because that when you don't have that connection, you aren't listening to your body, right? You're always up here thinking, which is where illness occurs. Nourishment. Many of you guys come to me, you already have too restrictive of a diet. You're seed oil free, egg free, nut free, dairy free, gluten free. Did I say egg free? All that stuff, and you're still sick. So a lot of times I don't have to streamline your diet. If you're still eating gluten and dairy, they are adding an inflammatory load, especially within the United States, where we have used a lot of pesticides, right? So really reeling your diet if you keep having recurrent flares, if you will, of period flus or fatigue or brain fog or any of the stuff that we're discussing today. And again, movement. I really try to prioritize, 10,000 steps a day, really moving my body. It is a privilege to move your body. Many people cannot. So our ancestors moved all day long. And when you visit blue zones or different areas where people live past 100, the elderly people are in the streets lifting things and walking up hills till they're 90. And that's really, along with the community, why people live so long in those areas. Okay, so after we address nervous system and terrain, drainage comes first, right? So if you guys aren't pooping, you're not sweating properly to within 10 minutes in a sauna, your liver is stagnant, you can't handle a glass of wine, or you can't skip meals, you get hangry and want to kill somebody, or all that stuff. That's signs that your body's a little off kilter or stopped up. And stagnation is what breeds disease, right? If you have flowing water, it's pretty good. If you have stagnant water, that attracts mosquitoes to the pond, right? So the body is the same. So we really want to kind of prep it before any sort of detox. That's a nice thing for you to do. You can always do homeopathy whenever, but to optimize the body means better success for you. And no protocol will stick if you're in nervous system dysregulation. So always go back to that. Okay. So I really have some offers here for you guys. These are my products, my formulations, full disclosure, Elemental Edge, Tadka. You guys should be getting a companion email where you have all the links with all these products in them for you to purchase as well if you're interested. So don't worry about writing anything down. We will be sending you a companion email with all the links. So Elemental Edge, do not take this if you're not eating. Only take on a full stomach. It can cause crazy nausea because of the zinc and folate in it. It also has things like molybdenum, boron, magnesium, selenium, iodine, all those trace minerals in very high doses. That helps to stabilize mast cell membranes. Histamine always has a component of lacking in copper or a zinc dysregulation. So really the missing nutrient is often copper, which is in here with zinc. Tedka Max is the name of the product. This is NAC, N-acetylcysteine, milk thistle, shilajit, and Tadka. So it helps to move the bile, which is where a lot of toxins hide, or toxins that love fat-soluble toxins. So this really helps to start to gently move the bile and liver. Adding minerals knocks heavy metals out, helps with sleep and hormones and neurotransmitter production as well. And then once the bile is moving, once the bowels are regular, 1 to 3 times per day, minerals are replenished, then your deeper work is much more tolerated by the body. It feels much more stable to accept something new. If you guys are out there and you're a sensitive Sally or canary in the coal mine, you go at your own pace. And if you can't tolerate things like this, it needs to go back to the nervous system. There's also some gentle sensitive genotypes. If you really have had problems with histamine most of your life, you really want to look at something like DAO enzyme, which helps to break down histamine. And sometimes if you've had allergies or exercise-induced asthma or hives when you were a kid, that can signal that you have a genetically low DAO enzyme. So you can imagine if you have long COVID, a herpes virus reactivated, maybe you live in mold too, and then you can't break down histamine, you've got the triple, quadruple whammy there, right? Okay, so other compounds against EBV here, you guys. So EGCG is from green tea. This helps to block some of the replication of Epstein-Barr. Quercetin and monolaurin are great too. L-lysine is another one. Things like curcumin and resveratrol are antioxidants. Sulforaphane is from broccoli sprouts. And then again, the high dose minerals can really help as well to stabilize mast cell membranes. Anytime you can stabilize mast cell membranes, you decrease histamine, which decreases the chance of Epstein-Barr virus and other herpes viruses reactivating. Okay, here are the key takeaways just from what we've gone through so far, and then I'm going to go through, besides the foundational support, the rest of the SSR kits or homeopathy kits, which are made for each herpes virus. Okay, so basically Epstein-Barr is nearly universal. Just because you don't remember having mono doesn't mean that you're not seropositive for it in the blood. Make sure you ask for the correct Epstein-Barr panel. COVID-19, especially severe illness or multiple bouts of COVID, can reactivate Epstein-Barr and other herpes viruses, as we talked about. Long COVID is linked to Epstein-Barr reactivation markers, so it's like what came first, the chicken or the egg here. Most strongly for brain fog and fatigue. Mast cells and histamine are a real overlapping third piece in the long COVID picture that lets these two interplay with each other. Again, testing is nuanced, right? You really want to ask for an Epstein-Barr early antigen, as well as you can get a SARS-CoV-2 antibody or spike protein quantitative level from Quest, which is your local blood work center. It's like a LabCorp's competitor, and that one's around $80 to $100. I do say, people are saying, well, that means you have immunity to COVID. If you have the symptoms we're talking about today, like brain fog and fatigue, and you have a spike protein level that's in the thousands when it's supposed to be less than zero point 0.8, again, that's a lack of immune surveillance and a vigilant immune system, especially if you haven't had the COVID vaccine or COVID in 5 years. Same as if Epstein Barr. So again, you want to go back to the terrain of the body to help keep the virus quiet. Okay, I think we went over all this, so you guys will get this here. We'll just go over the back stuff here. Again, some of my favorite things, high dose minerals, nanoglute B by Aegis as well. Seeking Health has, nanoglute B is methylated B vitamins for you guys who are sensitive. Seeking Health has a lozenge called hydroxycobalamin with folinic acid. It is a cherry lozenge that tastes delicious. I have that one too. And it's for all the sensitive genotypes out there. It's even autistic children can take that one. Stagnant livers, 1 out of 3 Americans. TUG, as I mentioned. I also really like liver drainage by Desbio, who we're getting ready to talk about. And for those who need histamine support, which is really a band-aid until we can get to the root cause, I mentioned DAO enzyme by Seeking Health. And then Desbio actually makes a product called histamine. They also make one called MCAS support here. Here we go, MCAS support. And this one also goes with histamine and is a natural homeopathic that really helps harmonize the body until we can get to the root cause, calm things down for you. I don't want to discount things like Claritin, Zyrtec, Cromolyn, and Ketotifen, which are prescription medications, antihistamines for people who really need it. Okay, guys, first and foremost is the HERS kit, SSR kit by Desbio. This is for herpes simplex, so cold sores or the STD. And again, as you can see here, you can see what it's for. What's in the kit? There are 10 vials that come in the kit. You take a vial every 3 days. And if you go 1 through 10 in ascending order, you need 2 kits. You are going to go 10 through 1 in descending order, taking a vial every 3 days. So the protocol is 2 months long in 1 through 10 ascending and 10 through 1 descending. And most people do not react negatively to this kit. They do just fine. I've done this kit a couple times. In fact, if you guys can see here, I'm actually on their 10 million kit now. This is their 10 million kit. And you can see here, I'm about halfway through it. When I took the third vial, is when I got a sore throat an hour later, and then I ended up with COVID because the kid actually pushed what was already brewing out from my trip to New York and pulled it out. So that's how much these two interact. Yeah, these kits are amazing. Since I've taken them, I haven't had one cold sore, and it's been almost 2 years now. So it's a really great thing to do, and I probably will repeat it annually. Next one is HERS SSR by Desbio. This is, you can see, it's not with an S, it's with a Z. And this one is for shingles. Okay, so you take it the exact same way, you guys. It's a 2-month protocol with 2 kits, taking a vial every 3 days. You may be asking how homeopathy is working. It's sort of like an allergy shot, giving the body a little dose. Hey, do you see the problem? How about a little bit more? How about a little bit more? All the way up till 10, which is the strongest strength. It's kind of like ripping the blinders off for the body, and the body says, we see you now, we missed you before. And so oftentimes people have what's known as Herxheimer or healing detox reactions when the body sees what it missed. It sets off the inflammation cascade to fix it. With these 2 kits, the HERS and HERS kits, HERS, they usually do not cause too much of a Herxheimer or healing detox reaction. This one can if you have long COVID, but this one for the herpes simplex does not. Okay, so most of these 2 are pretty gentle compared to the EPST kit, which is for Epstein-Barr virus. If you're someone that has waxing and waning, scratchy, sore throat, swollen lymph nodes, fatigue, and brain fog that comes and goes with stress and insomnia, this is the kit you need. If you're someone who has cold sores or shingles, it's the other 2. And remember, all of these reactivate with long COVID. With the Epstein-Barr kit, I want you guys to prep your body first. I want you to be careful. This one does cause healing detox reactions. And when it does in the kit depends on how bad of a root cause Epstein-Barr is for you. If it's really causing a lot of autoimmunity for you or symptoms for you, you may feel this as early as the 4th vial. Most people that I see in clinic don't feel bad until 7 plus. So I'd say the 7, 8, 9, 10th vials. Sometimes they will have what we're curing kicked up. So I've learned a lot from this kit. I've learned that laryngitis and so many other symptoms, rashes and things like that can be Epstein-Barr, a lot of autoimmune conditions. I've reversed rheumatoid arthritis with this kit. So there are things that these homeopathy kits, they're very gentle, but when it's your root cause, the body sees the problem and is harmonizing itself, and you really have to have the body see the problem to fix it. Last but not least, you guys, this is a special surprise for you. This kit is not available yet. This is a pre-order session for you guys with DeskBio. They actually are nice enough to allow us to let you guys have first dibs at this. So this is stands for the SARS-CoV-2 SSR kit. So this is their long COVID post-respiratory kit. So if you're someone who's had palpitations since 2020, racing heart, you may have POTS diagnosis. You may have bloating and brain fog and severe insomnia where you wake up multiple times. You may have weight resistance because histamine makes you puffy. You may have really changed the trajectory of your life since COVID. This is definitely a kit I would try if I were you. And I can't tell you guys whether you have healing detox reactions because no one has taken this kit yet. It's brand new by DeskBio. I can just tell you that I've been so impressed with their SSR kits. I cannot wait for this one. So if you're someone who's suffering from long COVID and you've tried many other things and you haven't tried homeopathy, I encourage you to because I've really become such a believer in the last couple years since COVID. This has literally saved my patients, the Epstein Barr kit, the Herpes kit, the Shingles kit, all of them. All right, guys. Thank you for patiently watching, and um, I appreciate you guys saving your questions till the end too. Hopefully everything made sense, but you'll get a copy of all these slides, so don't worry. And you should be getting a companion email that lets you guys order from the DeskBio store, order some of the Aegis formula stuff, the HERS kit if you want to do it with me. Don't start with the 10 million, start with the SSR. And the 10 million is a deeper one. Some of my other favorites are the Ultimate Spike Detox 2. Whoops. There we go. Ultimate Spike Detox 2. This is Peter McCullough's formulation. Obviously, it's herbs and nattokinase. It works a completely different way than homeopathy. So you can pair them together if you're super resilient like me. If you are a sensitive Sally, please don't do that. Know yourself, don't push all the time, right? Especially if you're sensitive. We don't mean to make your body worse or throw you guys into more of a flight or fight. I'm trying to make you guys calm down most of the time. Okay, let me check some questions here for you guys. Okay. Yeah, I know. I can't, for some reason, thanks, Siri. She's like, the chat is disabled, by the way. For whatever reason, you guys, I've tried to sit in the chat settings and it would not let me turn that on. So I think on a webinar, it may just only allow you to do the Q&A. So I apologize for that in advance. Okay. Um, I'm so reactive, I can't even drink water now. And I'm a type 1 diabetic. Wow, that's really dangerous. I'm so sorry. It developed MCAS after COVID twice and strep. Lysine makes me react too. Yeah, so I'm so sorry. You're someone that I would really start with nervous system work. I don't have it sitting right out here that I see, but I normally have my Pulsetto sitting right here during my consults, and that's something that I would recommend for a lot of you guys. It can be a game changer, especially for autoimmune patients like you. Um, the Pulsetto, people who really need it will say that it's electrocuting them, and here it is. Thank you. It's not really actually electrocuting you guys. This is what it looks like. Goes around the neck like this on the carotid sheath. You need a little gel right here, and then it sends a microcurrent to the vagus nerve through the carotid sheath. Now, people who will tell me it's electrocuting them and they can't even hardly stand it, and I'll say that means you need it more. Your vagus nerve is so hypervigilant and out of the right tone or firing improperly that that means it's singing the horrible, I don't know, screamo songs to your organs rather than love songs. So it talks to all different organs on the way down. So if it's in the wrong tone, it affects everything from hormones to neurotransmitters to prosody of the voice, sexual stimuli, the way your metabolism works, everything. So you really need to start with things like um, calming yourself, tapping, emotional freedom technique. Body code is another good one. Somatic work. Things like primal trust, which is a nervous system regulation program. You're someone, honestly, that I wouldn't throw supplements at right away. You may even react to, in fact, I'm pretty sure you would even react to some of the homeopathy that's in alcohol. So for you, you have to calm your system and feel safe, make your body feel safe, or it just will reject every single supplement that you're doing. Sometimes the supplements can be counterproductive. In someone like where you're going, we have to calm you down first before COVID is like really rattled your vagus nerve. There are often even brain clinics where they do neurofeedback and cold laser and hyperbaric oxygen chamber, interactive metronome, and they'll take you for like a week, 8 hours a day, and really reset you. So sometimes people need intervention like that as well, especially after COVID. I hope you feel better. Okay. If someone has high Epstein-Barr titers like IgG, which is a past infection, but a normal early antigen, would you still treat with Desbio herpes or Desbio EPST SSR? So yes, I think I would. And really, that's a great question. I've seen this a couple times in clinic now. So there'll be these like sky high IgG numbers of past infection, like I don't know, 5 to 700 or something. That's outrageously high, which is supposed to be less than like 20. And then you'll check an early antigen and it'll be normal, be less than 9. It's normal. And then you're like, dang it. Because sometimes people have this symptomatology that mirrors so much of Epstein-Barr, right? And if that person, I would really kind of Sherlock Holmes their health. If that person had mono when they were younger and it took them out, if they have all the symptoms of reactivation, if you're pretty sure that you just didn't catch it red-handed, I think I would still treat because the treatment is so benign anyway that it's worth it for me. So I think I would still treat. Okay. Hello. Hi, Dr. Jess. I'm here because Gary Brecka sent me to you. Thanks, Gary. I just joined in December of last year. However, your emails were going to junk, it seems. I was on your last Ultimate Human live Q&A. I reached out to Morgan and Gary during the event, and they told me to go reconnect. Here I am. It's really nice to meet you, Melissa. Thanks for being here. Gary and I work a lot together. He's actually an amazing human being. In real life, he's just like he is online. And I really appreciate Gary because he's been breaking open into the mainstream with functional and root cause medicine and how important it is just to have minerals and B vitamins and calm your nervous system. And, that kind of stuff hasn't been talked about before in the mainstream. So it's really nice. I appreciate his mission a lot. So glad you're here. Okay, let's see. All right. I finally started feeling well again after over 10 years of chronic illness off and on. Then last summer I got food poisoning and I've never fully recovered from that. Improved and did nervous system work, then had suspected COVID and respiratory syncytial virus or RSV or another respiratory virus on and off for the past 2 months. I previously had long COVID for 2 years. I started to improve, but when I try and push through and return to normal life, I get worse again and it comes back. I have also suspected gut mold colonization from an exposure 10 years ago, dysbiosis and suspected SIBO, so I'm reluctant to take antibiotics. Yeah, I wouldn't do that. Question one, how would you establish whether I actually need antibiotics versus continuing to support recovery naturally? And what would you recommend someone in my situation does? Number two, how do you distinguish Epstein-Barr herpes reactivation from COVID, post-viral illness, or other repeated infections? So just kind of what I went through in the whole webinar, I would say, I would definitely get an Epstein-Barr with early antigen panel. I would get a SARS-CoV-2 antibody. If some people have a personality they need to know, other people, if they hear the treatment, they feel comfortable, they can just treat because the treatment's pretty benign too, right? So I would check on those two labs if you can, see what they show. And then if they show that, then I would go straight to like the Ultimate Spike Detox along with the new SARS-CoV-2 respiratory kit from Desbio and then treat that. And I wouldn't treat Epstein-Barr until after that. Treat long COVID first because long COVID is the root cause. It's actually what's causing your body to release histamine appropriately, by the way. That lets the herpes viruses reactivate. So they're the secondary reason, not the root cause. So if you've had long COVID for 2 years, just caught another respiratory illness, it's triggering your immune system again. I would just go ahead and treat with that first after you test, I think. Okay, hopefully that's helpful. Can you do the Epstein-Barr kit while breastfeeding? Yes, you can actually, because it's homeopathy. So yes, that's safe to do. Okay, one more question here. My work involves frequent travel, changing time zones, disrupted sleep, and late nights. I mostly eat paleo. I'm sober. I don't do drugs or smoke, although I love what I do. Is my goal to avoid these things. What would you prioritize to rebuild that resilience and prevent future relapses? It's really just about connecting your mind, body, Connection again and tapping in. It's about like, when you know that you need to stay home and instead you go out. It's about saying no to those things and letting go of the FOMO and kind of learning to nurture yourself and what you actually need. Because a lot of people will keep themselves in flight or fight because they had a chaotic childhood or because it feels familiar. It's not necessarily what's best for them. So it's really about, you've done the nervous system work. Did it hold? Did you take it? Did you accept it? Did your body release things? Sometimes people can do the work, but it doesn't really stick. So it's really about checking kind of in with it, with that, without me being your patient. I'm not sure how much more to say here. Yeah. Do you see eggs as an HSV, EBV trigger in some people? And how would you test whether eggs are genuinely triggering cold sores? So sometimes bioresonance scans can be helpful for that. Food sensitivity tests can be helpful, but if you have leaky gut, you react to most things you eat every day. It's the gut's problem, not the food a lot of times. So I don't necessarily think eggs reactivate that in many people unless they're eating conventional, store-bought eggs, right? So, but yeah, you can always test to know for sure. Could you take all of the kits? What order do you suggest? Yes, you can take all of the kits for sure. What I do in clinic is I do something like a viral panel or a tick-borne 2.0, which not only looks for Lyme and co-infections, but exotic viruses. Or you can do blood work. And that really tells you the priority of what you need. There's also a strep kit, there's a Giardia kit, there's a boba kit for Lyme and Babesia, right? So all of these kits I've used in different times, depending on what takes priority based on testing or symptomatology. So it's really not a straightforward question. This is where the art of medicine comes in, is we're asking your patient the right questions to tailor what takes priority or how long it takes priority, right? So it's really, that's a hard question to answer. You can take all the kits, but it's really about, have you had reactivation of shingles more or reactivation of cold sores more? Have you had the symptoms of Epstein-Barr more? And if you can't answer those, I would test to see. Okay. Oh, you're welcome. Very welcome, of course. Okay, can SIBO be a cause of long COVID? I have severe MCAS too. No, it would no. Long COVID actually can cause SIBO-like symptoms. I don't know if you've had a methane or hydrogen breath test to actually confirm SIBO, but symptomatology sometimes is enough for me with SIBO. COVID is a spike protein that sticks in the mucous membrane, so it burrows here and replicates, and in the gut and replicates. When I got COVID, I actually got nauseous. It attacked my gut. And so I had leaky gut after that. So long COVID can be a cause of leaky gut indirectly, and absolutely it can be a cause of MCAS. 1000%, especially if you're someone who had trouble breaking down histamine in the first place. You got something that made you produce more histamine, right? Okay, if you have Epstein-Barr while pregnant, does that usually get passed to the baby? If so, how can I support my baby with that? She's currently 7 months. Well, here's the thing. The truth of the matter is, whether it passes or not, the baby is probably going to get it because 90 to 95% of people are seropositive for it at some point in their life. And then you remain positive for it, right? So the truth of the matter is the stats show us that almost all of us are going to have our fight with Epstein-Barr, right? Okay. Is seronegative psoriatic arthritis a candidate for Epstein-Barr? No, actually, that one is more connected to strep. So if I were you with psoriatic arthritis, I would look into the strep bacteria. And yes, they do have an STRE kit, which is their strep kit at Desbio. And I have used it. It's great. It also helps with PANS and PANDAS, which is also related to strep. How do you know which kit to choose if you literally have all of the mentioned issues? I think we kind of already answered this one. I would say really it goes back to symptomatology and testing, right? I had shingles, then I got the first vaccine, COVID shots, but then didn't get the second one. Should I get the second vaccine or not? I would say absolutely not. So with the shingles vaccine, there are risks from all of those. I think again, there's a way to make the resiliency of the body improved so that you don't have to suppress symptomatology or be afraid of any sort of reactivation of any chickenpox or viruses. Okay, I'm not sure I understand the question. What about pathogens? What are the ones that hold up recovery? I'm not sure I completely understand that question. Um, yeah, I'm not sure. Sorry. Is ultimate spike detox better than cardio immune? That's really, your guys, they're pretty close. They have a lot of the same symptoms. Cardio immune also has nattokinase. It has like isoterrace root, cat's claw, wormwood. There's a lot of different stuff in that one. I think cayenne as well. And this one has turmeric, dandelion, nettle seed, black cumin seed, dandelion root, black pepper, selenium. Yeah, so there's a lot of different, and then there's nattokinase as well. So there's a lot of different ingredients in both of them. They both are decreasing inflammation. So I wouldn't say necessarily that one's better than the other. I would say they work differently. And so better is very relative in healthcare because everyone's body is different. Everyone's genes and exposures and toxin buckets are different. So it's really about like getting in touch with your mind and body and reconnecting that. And then when you take a supplement, how do you feel? Is it actually achieving? If something's working at first, you may feel a little fatigued and you feel worse. Like when people take the Epstein Barr kit and they come back to me and they're like, "Are you kidding me? I feel like garbage." And I'm like, "Is it tolerable?" And they're like, "Yeah, it's tolerable." I'm like, "Bravo. We're getting to the root cause. This is it. This is it." If they tell me it's not tolerable, what you guys can do is take one of these little vials. Instead of taking it every 3 days, take it half of it. You see where the liquid is there, right? Take half of that instead of the whole vial and take it every 5 to 7 days instead. So you can prolong the protocol to prevent these healing detox reactions. I've had people where Epstein-Barr is their root cause so much that they've had to not take a vow for like every 10 days, right? And they've had to take like I had someone who had to get a little syringe and draw a couple drops every couple days. Now that's super rare, you guys. It's rare. I've only seen it once or twice in my whole time. But it does happen for certain sensitive folks, and there are ways to temper protocols so your body slowly acclimates to it. You don't have to go pushing a square peg into a round hole all the time. Just listen to your body. It'll tell you which one is best for you, really, what you can handle and what you can't. Oh, so I just answered your question. How would you prep to minimize the detox effects of the EPST? So just be sure, if your symptoms kick up about 20% greater, I want you guys to feel a little fatigued. I want you to feel a little inflammatory. That means it's working. Really. That means the body is seeing the problem, setting off inflammation to fix itself. But you should be able to get up off the couch. If you can't get out of bed or off the couch, you can't do your activities of daily living, that's just too much. Then you take half the vial and you space it out. But you also know, wow, I'm going to feel a million times better when this is over because my body is redirecting itself and finding order out of chaos. Okay? Can you explain what you would put in an MCAS flare kit? So there's actually a new MCAS support kit over at Bio. It does have the MCAS support product here. Sorry, the lighting is a little off here. There we go. Closer to my face. MCAS support is what it says. There's also histamine at there that we're going to link in your guys' email that's coming out. Um, and they also have um, a enzyme blend there, transzyme, I think is the name of it, that has serrapeptase nattokinase. They also have liposomal resveratrol curcumin, which is amazing for MCAS. So, also things like the Pulsetto can stop things like the pulsating vagal nerve stimulator I showed you can stop things like a M-class flare, it can stop anxiety in its tracks. It really helps with insomnia. And then really DAO enzyme. If you have, it's really a benign thing. And if you have that, it will change your life. Really. Okay. Of the kits you just described, and a person has multiple symptoms and issues, how do you know which kit to start with? Again, the same question. So I would say, if you have shingles, go with a HERS with a Z kit. If you have cold sores or HSV2, the STD, go with the HERS HERS kit. If you have waxing and waning symptoms of Epstein-Barr, the EPST kit. And if you have suffered from COVID, had vaccine reactions after having the vaccine, never been the same after COVID, I would definitely try their maybe histamine band-aids as well as the SARS-CoV-2 SCV2 SSR kit, which is new. No one has tried it, guys. It's brand new for you to pre-order here. You have that. I'm offering that as a gift to you guys here. I'm working with Bio. Okay. My 7-year, oh wait, what are internal tremors vibrations from usually during sleep? That's from nervous system dysregulation and or parasites a lot of times, but that's nervous system dysregulation. My 7-year-old daughter gets cold sores. Do you have any Yeah, yes, the whole slide deck was on that. So just do what I presented in the slides. Yes. Perfect. I am sensitive Sally and ordered Tecamac. Should I take on an empty stomach? I ordered it, but I've been afraid because I don't know how. Tucca actually absorbs better with fat. So if you eat something like with avocado or some good fats in it, that actually will help it absorb. So take it with the meal. Um, how to heal gastrointestinal long COVID, loose stools, vasovagal response after every bowel movement. Thank you so much. I would just work on what we talked about here. The new kit from the homeopathy company plus the ultimate spike detox. And then really working on nervous system regulation, vagal tone. Something like a vagal nerve stimulator is really important for you guys. Okay, let's see here. Detox spike before mold, Lyme, Bartonella, dealing with all right now. I'm a histamine oxalate factory. Thoughts on IV ozone for the spike as well. It's an accessible and cost affordable for patients. It's ozone is kind of it depends on if you do like a 10 pass or EBU that can get really expensive, like upwards of $1,500 to $2,000. But if you do just 1 pint of ozone, it's really probably not going to move the mark very, very much. If you do a 10 pass, it might, but it's a killing process, so be careful. You need to have your body prepped with all the foundational supplements. Um, and also, really just be sure that you are your nervous system is balanced and that you're pooping and peeing and sweating and your liver and bile are functioning properly. And then, your body will rid itself of many things that are root cause that are attracting said toxins, pathogens, because if you're hospitable, they will stay. So you have to kind of ask yourself what's made you hospitable. And usually it's a combination of toxins and trauma. So. Okay. And then let's see here. I've had a histamine issue since 2020. Sounds familiar. Have lost most muscle tissue since I can't tolerate much. I did buy the Pulsetto to help with nervous system, but I noticed I lost skin color over my thyroid. I'm not really sure what that means, skin color. I don't think that's anything to worry about or having anything to do with a Pulsetto, honestly. I bought the Pulsetto because of you. The fit works on a small neck if anyone is concerned. It seems to help me some. Yeah, it's just being consistent with it. It's literally 4 to 6 minutes a night. And anyone who's busy or owns their own business or anything like that can afford 4 to 6 minutes a night. And it's really hard to stay awake with that thing on, you guys. It's really difficult. It works wonders, actually. I got the Pulsetto, but this has kicked up hot flashes. Is that normal? No, it's not actually. Not at normal at all. So I haven't heard that one before. So I wonder if it's actually just changing your nervous system a bit. I don't know. I've never heard that. Can Epstein-Barr reactivation be related to EMF sensitivity? Yes, I think it can actually. If you're sensitive, someone who's sensitive to EMF, 5G, amongst other things, this can be and just another toxin that can actually kick up or reactivate Epstein-Barr. It's anything that puts your body off kilter or out of homeostasis, lets this pathogen be opportunistic. It's more about why are you catching things when other people aren't? What is different about your body or keeping it out of homeostasis or balance? To make it hospitable, right? My daughter, who's 21, has constant swollen tonsils, recurrent infections every 2 to 3 months for a few years now, always negative for strep and COVID, recently negative for EBV. Can she be tested again with those markers outside of an infection? Yeah, she can. Absolutely. If she's not having an episode, you may not catch the early antigen actively, active or positive. But if she's had those symptoms, it's very, very suspicious for sure. I would also look at cytomegalovirus, which can sometimes cause symptoms like EBV. It's called CMV on test. Okay, guys. For years, I've struggled with mold toxicity, and while I've worked through detox protocols and had a severe exposure that was long term, I can't help but wonder if something else is playing a role here, like HSV and long COVID. Yep, that really is suspicious for me. I've done a ton of work and tolerate exercise now, and most supplements except strong antifungals. Weight issues remain an issue. Used to be a fitness enthusiast and I'm in great shape. So I would definitely look at those markers, the SARS-CoV-2 antibody or quantitative spike level, and as well as the Epstein-Barr with early antigen panel. Those two will give you your answers, but if you struggled in the time frame and the trajectory is there, I would be highly suspicious for sure. And with mold, I see that a lot with mold actually, because both the spike and mold burrow here and follow you after you leave a moldy house or after COVID, right? They can continue to replicate. Is it okay to do the EPST kit and the new COVID kit? I would stage those two. I wouldn't do them together. That could be a rough road because I don't know how bad the COVID one is going to be, but the Epstein-Barr one is a rough one. If it's root cause, it's rough when you get in the higher vials. But man, it works. So. Okay, nurse here was required to get COVID vaccine to keep my job. After second jab, severe histamine issues and chronic migraines. Ended up with shingles, Epstein-Barr antibody, IgG elevated, and CMV elevated within the year after. Still 4 years later, my CMV is elevated. Oh my gosh, IgG and IgM. I still struggle with MCAS symptoms and chronic migraines. Every doctor says they do not believe my CMV labs. Can it be cross-reacting with something else? I'm not sure why they wouldn't believe it because it is a herpes virus. So it's just, the weakest link that's taking advantage. There is a Cyto kit by Desbio, CYTO. It's for cytomegalovirus or CMV. If that takes priority on your labs, I would probably start there with you as well as long COVID. Actually, I'd probably start with long COVID with you. Says, do you have a vaccine injury, actually? So the long COVID kit that we talked about, the SARS-CoV-2 SCV2 SSR kit, along with histamine and the MCAS support from Desbio, and then some of the foundational supplements for you too. And then you can go after it with the Epstein-Barr kit. But that one is going to be tough for you. Definitely you're having histamine headaches too. Definitely from long COVID. Okay. Would you say the same for IgG for herpes too, as well as when result is high positive? Why is that there's no cure for this STD? Exactly. It's kind of ridiculous. I mean, they make a lot of money off these chronic valsaclavir and acyclavirs that they continue to give patients, and it doesn't suppress any sort of outbreaks. So you're on them for most of your life, even with suppressive therapy sometimes. So, this is a chance for people who have something like that to regain control and stop having outbreaks. I've stopped a lot of people from having genital herpes with these kits. So there is hope out there. It's just really about your terrain and your stress, as you know. Oh, thanks. You're welcome. I'm glad that I can be of help. Is EBV a root cause of Crohn's disease? It's not one of the chronic conditions listed with this, but Crohn's is a lower vagal nerve dysfunction as well. So it's like the upper vagal nerve is a lot of neurodegenerative conditions. Down here is like inflammatory bowel disease, like Crohn's and ulcerative colitis. So, a vagal nerve stimulator would be helpful for you. And really just looking at things like parasites, anything like candida, things like that can be useful too. And then Klebsiella pneumonia, best way to get rid of it. That's nothing to do with the webinar, so we'll ask that. If you have EBV while pregnant, does that usually get passed to the baby? We don't know for sure. I think this one's already been asked. Can EBV cause a colitis flare? I would say long COVID can do that more than EBV, actually. Do you ever use low-dose naltrexone for MCAS? Yes, that low-dose naltrexone is really helpful for immunity and pain. So it pulse doses the opioid receptors without being addictive, and it helps to reset anything from fatigue, brain fog, energy, even hormones. Some people react well to it and other people don't, just like any sort of immune medication, right, or prescription. So it's not for everyone. I would say start very low and work up. But yes, it's great. Working on that flight or fight. I'm good. Don't be scared. Don't be scared. Major nervous system issues after COVID in 2020. I've tried everything. I bought the Pulsetto, but I had a reaction after using it. Is there a certain setting I need to start with? So no, just because you had a reaction doesn't mean you stop. Just go in and go slower. Do 30 seconds on the lowest setting. The light on 30 seconds. That's okay. Don't do 4 minutes out of the gate. Just do 30 seconds and work up another 30 seconds the next night, or 20 seconds, whatever you want. But go slow so your body can acclimate, because your body is not safe at all. Not safe at all. It's freaked out. Does the new Desbio kit for COVID get rid of spike protein? Yes, in theory. That's a great question. They also have the tobacco homeopathic, if you guys are interested in adding that. I didn't include that in here because it's just too much. But if you really want to knock the spike out from the nicotine receptors, nicotine or tobacco does do that, whether it's a tobacco patch or a tobacco homeopathic. I've had shortness of breath, unable to take deep breaths. Was in the ER 2 years ago. I have chemical sensitivities, can't be near smoke, lots of different things. I asked if it could be long COVID, and doctor said no, no testing. That's not true, because that is due to a histamine overload. That's the reason you're reacting. You have multiple chemical sensitivity of mast cell activation. If that's kicked up since 2020, it's definitely due to the spike. Based on that trajectory, histamine absolutely is the root cause of all that. Sorry, get a new doctor. Okay, 6 weeks into shingles, diminishing nerve pain, tips on healing nerve damage. So I would do this kit. I really would. I would do this kit. The histamine in the nerve roots is what causes that sharp electrical nerve pain and tingling. So do the kit. It really can take care of some of that post-herpetic neuralgia for you. Okay, guys, I'm going to try and wrap up some of these questions here. Is there any amount of time or certain signs that appear to indicate how short or long you should use the Ultimate Spike Detox before moving on to the EBV kit? I normally tell people to do that for at least 4 months. Once you're on it for a couple months, you can probably add the Epstein Barr kit, but it depends on the person. It depends on how resilient they are. If you've had the vaccine, Peter McCullough says you need to be treated for a lifetime. We don't know yet. I think it's too early to say that, but you definitely need to be treated for probably more than 1 to 2 years at the very least. If you have long COVID, EBV, mold, possible SIBO, would you do Desbio kit before or after treating mold and possible SIBO? Well, you need to get out of the moldy house first or nothing will stick. That's the whole impetus of everything. So I would say you can treat mold and COVID at the same time because you need to do a nebulizer to get both of those out of the sinus cavities. And really sweating and binding, get rid of mold and moving bile with Tudka and things like that. Let's see. Oh, yeah, you're welcome, guys. Is there a test for mast cell and histamine? No, there's not. Got such a short half-life in the blood that tests are sorely inaccurate for histamine. Sometimes you can catch a high IgE immunoglobulin, but not everyone shows that. So it's really hard to get any sort of positive blood work with us with histamine. Okay. Average length of time to move through long COVID. Well, if you don't do anything, 2 years, yeah, but these kits get rid of it immediately. That's why I'm providing them to you guys. Okay, guys, we're going to wrap up on the questions here. I think I've covered most things, but I think, just know that we will be doing more of these. This one is going to be free for everyone, but on my Wellness Plus platform, which is wellnessplus.com, we do these webinars quite frequently, and we are giving Wellness Plus a whole new facelift and rejuvenation, and I'm going to be doing mini webinars on there probably every 2 to 3 weeks for you guys. This is just one, and the next one we're going to be doing is going to be on weight resistance and weight loss. So I'd love to see you guys there. If you have any other pressing questions, be sure you can email us at hello@drjessmd.com. And please don't forget that you are going to be getting another email that lets you see all these links that for everything that we talked about, we'll list them out for you so it's not confusing. Give you the links to the Aegis products, the Desbio products, what each of them are for. If you feel like you need more, you can always book a consult with my team. We do discovery calls to make sure you're a match for us, we're a match for you, and then we book packages for 3, 5, or 8 months, depending on what your preference is. That's at drjess.health. So I'd love to see you guys in clinic. I hope this was helpful. I see so many people suffering that I wanted to make this webinar free for all you guys. So thanks so much for attending tonight, guys. I hope I answered some questions or connected the dots for you. Tell all your friends they don't have to suffer in silence. And thanks for being here. I really appreciate it, guys. Have a great rest of your week. I'll see you guys soon.